The proximal lumbar paravertebral nerve block in cattle. The indication is the same as the distal lumbar paravertebral nerve block in cattle, and the procedure is very similar. The indication, it's done in a standing animal during a right or left-sided flank laparotomy. It's done when there's rumen impaction or abomasum displacement or cecal torsion. For the procedure, for sedation, give xylazine, ketamine, and butorphanol. It's all given intravenously in a standing position. For preparation, for the injection site, clip the hair, scrub iodine, and use alcohol gauze. And add 1 milliliter of sterile bicarbonate to 20 milliliters of lidocaine. This is to decrease the sting effect. When doing the distal lumbar paravertebral nerve block, locate lumbar vertebrae 1 at the process transversus. From the lumbar vertebrae 5 process transversus, go to the L1. There are 3 blocks: cranial to the process transversus L1, and caudal to the process transversus L2, and caudal to the process transversus L3. When doing the cranial to the process transversus L1, this blocks the thoracic nerve 13, and caudal to the process transversus L2, this blocks the lumbar nerve 1, and caudal to the process transversus L4, this blocks the lumbar nerve 2. For the procedure, insert a guide needle, so a 14G needle, and it acts as a cannula to penetrate the thick skin. And then inject 5 milliliters of lidocaine 2%. This is for the skin anesthesia. And then place the spinal needle. It's long. It's around a 16G to 18G. For the proximal lumbar paravertebral nerve block, you place the needle nearly vertical, whereas in the distal, it goes horizontal. You then inject 10 to 15 milliliters of 2% lidocaine, and you spread the volume 1% or 1 centimeter above and 1 centimeter below the edge of the process. And then you wait 10 to 15 minutes for proper anesthesia. The signs of a successful block are the blocked area gets warm, as well as scoliosis. This is a unilateral desensitization of the longimus dorsi muscle. So there needs to be anesthesia of the skin, muscle, and peritoneum. The common causes of failure are improper identification of the lumbar 1 process transversus, the angle of the needle, or too quick of an injection, and not spreading the lidocaine out, or by giving a lidocaine overdose, which will result in central nervous system signs, twitching, and recumbency. The maximum dose is 6.6 mg per kg of 2% lidocaine. This means for a cow, which is around 600 kilograms, you can only give 200 mils. And for a sheep that's 60 kilograms, you can only give 20 mils.